This is a short presentation on North Dakota Nurses Association, or NDNA. The North Dakota Nurses Association is recognized by the American Nurses Association as a subsect that represents all nurses in North Dakota. Their membership includes access to events, job postings, and tons of nursing resources. Currently, they're run by a board of directors as a 501c6 nonprofit organization located in Bismarck, North Dakota. I chose the NDNA because that's where I currently live, and that's where I plan to at least start my practicing as a registered nurse. The NDNA's mission statement is to promote the professional development of nurses and advances the identity and integrity of nursing to enhance healthcare for all through practice, education, research, and development of public policy. The NDNA is affiliated with the American Nurses Association as a constituent member. They're also affiliated with the Nurses on Board Coalition, which is an organization that promotes nurses to be on boards of nursing, boards of directors of other organizations, or in Congress, and does education and supportive resources. They're also affiliated with the North Dakota Board of Nursing and the North Dakota Center for Nursing. According to the NDNA, they are the only professional organization representing all nurses in North Dakota. So that means that they are representing a whole slew of nurses, including registered nurses, LPNs, BSNs, ADNs, the CRNAs, nurse practitioners, CNLs and CNSs, midwives, those with doctorates in nurse practitioning, and more. The NDNA has a couple of advocacy platforms. Right now, their platforms are workforce development, population health, nursing education, practice and licensure, care delivery, and funding. They impact legislation on healthcare policies and the position of the nurse within that healthcare system and those healthcare policies. They also support progression of professional development on a local, a state, and a federal level. They also promote advancement of identity and integrity of the nursing field by practicing, teaching, researching, and developing public policy. And finally, they also promote the scope and standards of nursing practice and the Code of Ethics for Nurses, which is published by the Board of Nursing as two of the main governing documents for nurses. Some steps that they've taken to advocate for population health include activities. They support community activities and programs that are addressing hot topics in the community, such as obesity, substance abuse, behavioral health access, early preventative services, and things of that nature. They also are having a stance on school nursing to increase access to school nursing with a collaborative health model that they've created, as well as cooperation with the school nurse administration and other healthcare professionals. They're addressing the opioid crisis in our community by supporting access to medication-assisted treatment via APRNs, so advanced practice nurses being able to prescribe that medication-assisted treatment. Also by programs like prescription drug monitoring. They also collaborate with the Nurses on Boards Coalition, like I had mentioned earlier, to assist board members in legislative movements. And finally, developing legislation on their own related to public health promotion and the programs that I stated earlier. Some additional advocacy steps that the NDNA are taking for both promotion of public health and overall nursing values include putting out a newsletter for events that are happening on Capitol Hill to keep people aware, as well as current news and a ton of resources like I had mentioned earlier. They're also serving as staff members on board of directors in Congress or as professional references in legal settings. The education and training courses for volunteer nurses performing community health checks help train those nurses to perform the community health checks on those individuals correctly and safely. They also provide resources for student nurses or coworkers or community members that are interested in healthcare to address Congress. They also promote awareness of public health issues via social media platforms. How can you get involved? In a community aspect, you can participate in marches, public political gatherings that are relevant to nursing and health promotion. You can also attend public forums or town hall forums for showcasing potential future legislation related to healthcare or related to the nursing profession. And finally, you can join a local political affiliation and support that by either canvassing or donating to their supported candidates. As an individual, you can write your own policy supporting or denouncing letters to your state representative to tell them how you feel and support your cause. You can also join a national professional nursing organization. It's your responsibility to stay informed, stay up to date on the current political climate, on hot topics, on the nursing field advancements, and finally, and probably most importantly, vote. As a peer, you can join your school student nursing organization as well, or you can attend or even participate in school debates that are using healthcare related topics for their arguments. And finally, you can keep your cohorts accountable to stay informed of current and future policy matters. And here are some references. Thank you.